Hello, Vincent Carroll speaking. Tutorial number 54, cholesterol. Cholesterol, of course, wasn't understood from an early TCM perspective. Again, cholesterol from a Western medical point of view has consequences, and of course it has origins to become cholesterol. And equally from an acupuncture point of view, we look at the signs and symptoms and we therefore trace back to what would, from a Western medical point of view, be considered as cholesterol. Let's examine. So, for example, one of the reasons why a person might end up with a Western medical diagnosis of cholesterol is liver and blood stasis. We're talking about a liver qi stagnation, and that liver qi stagnation is not moving blood, and blood becomes static or blood stasis. And blood stasis slows the blood flowing in the blood vessels from an acupuncture way of looking at it. Again, we're talking about the mirror image of blood, we're talking about the mirror image of blood vessels from an acupuncture perspective. So the blood, as we understand it, this energetic level of blood is flowing slowly in the blood vessels, and that allows accumulation along the wall that we would call plaque from a Western medical point of view. So that's, in my mind, is probably the main reason why people develop cholesterol who come to see me in my practice. It's very, very common, simply because liver qi stagnation is common, and because liver moves blood, blood stasis is quite common. And of course you look for other signs. You can't just make that as the diagnosis without corroborating evidence, and the corroborating evidence are all the signs and symptoms of liver qi stagnation, particularly a bloated lower abdomen. If your lower abdomen expands, if the lower jiao expands, the pelvic area expands and becomes uncomfortable, and I often ask my clients, my patients, do you have an uncomfortable awareness of your lower abdomen? And the answer is yes. And from a Western medical point of view, they're not really going to be asked that. Instead, a dietary history might be taken, or there might be an attempt to discover whether there is what is described as altered bowel habit, because from a Western medical point of view, altered bowel habit, in the absence of other reasons such as change of diet, is cancer of the bowel until proven otherwise. So it's a serious diagnosis if a GP makes the diagnosis of altered bowel habit. From our point of view, we're talking about an expanded lower abdomen that may or may not affect the three systems found in the lower jiao: the urinary bladder, which I've spoken about at a very recent tutorial, the large bowel, which I've also spoken about in a recent tutorial, and the gynae areas as well. All of these are systems that depend upon movement on progression, and if there is a qi stagnation there, they are affected to a greater or lesser extent. So therefore look for evidence. See, does the evidence rise up into the middle jiao? See, does that evidence rise up into the upper jiao in the form of oppression on the chest? But one way or the other, there will be congestion, there will be a stagnation, and that will lead, amongst other things, to the deposition of these lipids and plaques, which from a Western medical point of view, we call cholesterol. What do? You move qi, liver 3, gallbladder 34, you move blood, spleen 10, bilaterally. I would probably apply a gentle electroacupuncture to spleen 10 bilaterally for a number of minutes as a way of just moving stagnant blood, because of course that's what spleen does. Spleen 10 moves blood. That would be the commonest reason why people develop cholesterol in my practice, but people may also develop cholesterol who have phlegm, particularly a turbid phlegm. Phlegm is there because there's damp, and damp because there's a spleen qi deficiency. But if the spleen is not working properly, then in that case you have splenotransforming fluids. Fluids through body heat are going to morph into phlegm, and that phlegm may be deposited inside the blood vessels, forming a general sense of damp and phlegm in the body. That phlegm, of course, you need evidence for that as well, and you find all the evidence you need on a person's tongue. Phlegm normally presents very well on the tongue, where it can either be hot or it can be cold. And generally, I find people with cholesterol have a long history of generally moderate warm phlegm. So I would expect a yellow coating as opposed to a gloss white coating on their tongue. There will probably be other sides of phlegm as well. The person might be a heavy snorer. The person might miss words as they're speaking. They may say, I'm going into the drawing room, or I'm going up the staircase. There are these gaps and pauses in the language, and that's often a sure sign that there's phlegm there. If the phlegm is sufficiently cold, the person, of course, will produce a spittle spray in your direction. So that's another thing I think most people in acupuncture would be very familiar with, and all that can be a kind of a cold type of phlegm. But it's generally sort of moderately warm phlegm showing a yellowy coating, and you will expect, as I said, all the other signs of phlegm, and also signs of mild damp as well. I say mild damp because, of course, the damp is transforming into phlegm. So the more phlegm, the less damp, and vice versa. So again, what would I do? Stomach 40, lung 5. I would do bilateral spleen 9. I would tonify the spleen as well. And I'd find out what lifestyle adjustments can be made so that the person doesn't fall in to damp. Because if you don't have damp, you can't have phlegm. And if your cholesterol is coming from the damp phlegm axis, then in that case, you want to abolish the root rather than just the manifestation. Sometimes when people, especially much older people, go into a kidney yin deficiency, again, there is this empty heat, there's this uncomfortable warming, and this uncomfortable warming can stagnate the blood, can thicken it in a sense, if you like, from an acupuncture way of speaking, and that can deposit as plaques against the wall. So the kidney yin deficiency is something, again, that a person must look for. Very often it's a personality type. It's often associated with older people. It's often associated with people who've been through a rough time of it, or medical issues. In men, it's often associated with retirement. In women, it can sometimes be associated with menopause. But for anybody, it can be associated with chronic pain as well, or anything that wears down your sense of happiness in life, your sense of a belief that all is well. Anything that undermines serenity and calmness in your life is something that is a sure sign that your kidney yin is down. Of course, I find Ren4 plus kidney 1 bilaterally a marvellous combination when combined with pericardium 6 or even 7 on occasion. Can be a very good combination for kidney yin. But one way or the other, in I would imagine a relatively large number of cases, you can get kidney yin, the drying out of the blood, if you like, as a result of kidney yin due to the empty heat, forming cholesterol. But the trouble is, it often happens in old age, and people who are in old age very often have cholesterol anyway. So very often, I suspect, it comes from kidney yin deficiency. Very occasionally, kidney yang deficiency as well can lead to cholesterol, simply because when blood is cold, when the body is cold, movement is slow, and when movement is slow, movement can be sticky. And that can create plaques as well. And the only reason why that's particularly important is a significant number of older men end up as kidney yang qi deficiency. And of course, the significant number of older men also have cholesterol. But whether you do anything about it or not, or whether it is their chief concern, considering there's reason to be concerned about everything else, then you may not be actually treating it. But certainly in the younger person developing cholesterol, my own impression is I would look for signs of liver in the lower jaw. I would look for a sign of blood stasis and kidney and liver not moving the blood, because liver isn't moving anything, and of course qi moves blood, and liver qi should move liver blood, and when that doesn't happen, it can consolidate as plaque and as cholesterol, so as lipid masses or plaque developing inside the blood vessels. And I think that's the commonest. I think the second commonest is probably the spleen producing phlegm, and the concept of damp phlegm in the body. And the third would be both kidney yin and kidney yang deficiency, with a tendency for it to be more likely to be kidney yin rather than kidney yang. I think that's very common, but I think it's probably unrecognized for the very simple reason the person's quite elderly and have a range of other issues anyway, and their cholesterol isn't their chief issue. If it is, tonify the kidney, as I mentioned, kidney 1 bilaterally, Ren 4, pericardium 6 or 7, and if it's kidney Yang, of course, Mox on the Ming Men, which is Do 4, urinary bladder 23, right side, left side, urinary bladder 52, right side, left side, in other words, inner and outer back shoe points of the kidney, which line up with Do 4 anyway. So that is straightforward. So there you have it. 4 reasons, as I see it, why if a person with cholesterol, what is the reason for their cholesterol. But of course, give broader advice as well regarding diet and lifestyle. Obviously, that's very, very important also. Thank you.